All right, so did you go? Did you finish? So you got your MD,
MD.
right? What was that process like?
So the first 2 years are okay because they were basically like undergrad, like high school and so forth. Basically just studying and taking tests, studying and taking tests. So no problem for me. Around the third year is when I was like, what is this, man? This is completely different. When you basically had to go to the hospital all day.
Uh-huh.
You have to go from like 7 to, sometimes if you were on your surgery rotation, 7 to 8, 7 to 9. Or sometimes you were like on call. So you came in at 7 in the morning one day and you left the next day at like 8, 9 o'clock.
Wow.
So you're on rotation. So when it's like July or your third year, that's when it starts. And it starts early too and it ends late. Third year.
So just
and there's no
basically
summer
working,
vacation.
working in the hospital the whole
Working
time.
in the hospital, you're
Residency,
rotating
right?
through different. No, it's clinical rotations of
Really?
third year.
Is that prior to residency?
Yeah,
or-
residency is after you graduate
Okay,
from med school.
okay.
So I went through that. I think I did internal medicine, psychiatry, pediatrics, OBGYN, surgery.
Wait, so
the
you do
whole
all
shebang.
that? So you have to do all that to graduate the MD?
Exactly. You have to do all that in your third year.
Wait,
Just a
wait,
1 year
wait,
med
so,
school.
so for example, like you can like receive babies, like pretty much like
and
you're
that's
trained?
that's their final exam for OBGYN. Like you have to deliver a baby with its ugly ass placenta to graduate from or to complete OBGYN.
Wow.
So I was able to deliver a baby and deliver a placenta. I was lucky to not have passed out nor have vomited in the same room. But I had to like go
Wow,
home and
yeah.
take a shower.
So what other tests did you have to take to get your MD? What other like stuff in the hospital were you doing?
So you have to take your normal tests. So in the first and second years, it's just like all the tests that the Howard University med school professors are preparing for you. Third year comes around, you're taking nationalized tests. So you're taking what are called the NBMEs. So these are like National Board Medical Examinations that you take for each rotation. So example, if you take 3 months of internal medicine, at the end of the 3 months you take an exam, an NBME. And this is incidentally the same exam that every other med school student is taking across the country. So it's standardized results. And then there's no curve or anything. It's like
No
what you
curve,
get is what you get.
Okay.
So and that's the same thing that I followed for all of these rotations. So not only was I in the hospital from morning to night, I had to come home and study too. And
Wow, that's insane.
and if there was time left over, sleep and eat. So that was insane. And then I wasn't really a fan of those hours, and I wasn't really a fan of that setup because I was more of the studious type of lifestyle. I had to study and go to class, take the exams, and then
Yeah, but
I had
actually
time on the
working,
weekends.
yeah.
Yeah. Exactly.
I mean, so for example, you mentioned you just said like a psychiatry was one rotation you did.
Yeah, psychiatry.
What kind of stuff were you doing for that? Were you like diagnosing people or like Freud or something like that?
So that's more psychology, what
psychology.
Freud was. But basically what I did was I basically went out to St. Elizabeth's Hospital and I think it's in Southwest DC.
Mhm.
So I went out over there and basically was there from Monday to Friday, just attending to patients. I would go along with a psychiatrist inside of a room. Psychiatrist is taking his history and I was taking my notes too as well.
So, I mean, so what exactly is psychiatry? How's that different from like psychology?
So psychiatrists can actually prescribe you medication and psychologists cannot prescribe you. They can kind of diagnose you more or less if you have depression or bipolar
I mean, so
disorder.
were you doing stuff like what's that book, the DSM?
DSM, exactly. So I was using that book. I was actually reading that book cover to cover to pass that exam, the psych
Oh, this is the
NBME.
actual exam?
The actual
So
exam.
surprisingly, I've actually read the book as well.
Oh, awesome.
I mean, not just kind of, I was like, hey, because I was reading some stuff about psychology and disorders and stuff, right?
Mhm.
And I'm like, hey, maybe I have a disorder, or maybe I know somebody has a disorder, or whatever, right? So
Yeah.
I didn't really read the book, I kind of skimmed the book, right?
Right.
I'm just kind of like going through it, but I'm like, hey, interesting book, right?
Mhm.
And yeah, it told me some stuff about people in general, right? For example, like 4 out of 10 people are sociopaths, right?
No.
So that means almost anywhere you go, whether it's school or work, there's going to be a sociopath you have to interact with. And I'm like, okay, interesting.
Yeah, that would explain a lot of my interactions in the DC area. So yeah, so that was like just one of the rotations I had to go through in third year. And then by the time you get to fourth year, then it's all electives. So the electives are based on what residency you want to pursue after med school. So I was initially thinking about doing oncology and internal medicine. So right away I would have to opt for all the internal medicine electives like oncology, cardiology, GI, and so forth. So I think I picked endocrinology, oncology, cardio, and then some other like rotations. I think I did a radiology rotation as well because radiology is very important too for any rotation in internal medicine.
Well,
You got to interpret an X-ray.
so much stuff you're doing.
CT.
That's fine. This is why I
So-
told you this guy's a smart dude, man. All this and computer science together, right?
Yeah.
All right. So after you finished medical school, what was the next step in your progression with career or life? What happened after that?
So if I would have followed the game plan, I would have gone to residency. I would have gone to residency, then did fellowship, and then become an attending physician. And then I would be working basically in a hospital most of the time, 80% of the time, and 20% of the time in the clinic, outpatient.
Mm-hmm.
But I think it's something that was born out of something that happened even when I was applying for med school or doing the MCATs. I wasn't really interested in the clinical aspect. I wanted to go into the innovation, the technology aspect of medicine. So that's kind of made me hesitate when I was applying for residency. And ultimately, I didn't really apply for residency. I finished med school and I was like, no, I don't want to do clinical medicine. I don't want to work in a hospital all day. I want to actually be out there in the field inventing treatments that then doctors are going to use to improve patient outcomes.
Right.
So that's why I started to search for these types of positions in like biomedical engineering or these types of like medical innovation types positions, medical technology positions. So I was like searching for a while. So that was kind of like one of the setbacks, I would think. If we get to the section on setbacks, I think that was a personal setback for me because I was always at the top of my class and everything.
Let's go there right
I had
now.
everything. Yeah, I had everything basically handed to me. But that was handed to me on the basis of all the hard work.
Yeah, the hard work.
And the hours I put in, the reps I put in. But then for the first time, I saw all my classmates go off into residency, and then they would become doctors in a couple of years. And here I was. I went through the whole process, 9 years of study, and I wasn't a doctor technically. I had done all the licensing exams, but they won't consider me a doctor per se because I haven't done residency. But yet I was convinced, I was confident in myself that the next step I'm about to take is going to be even better than the step that I've left behind. That I can do much better than just working in a hospital as a clinician.
Right. Okay. I mean, so let's say how long is that path in terms of being like going after med school?
So after med
Residency is how long?
So let's pick internal medicine, for example, because surgery is a whole different ballgame. So internal medicine is 3 years of residency.
Wow.
Then it's like depending on the fellowship, like your specialization, if you want to do cancer research or heart
that's extra
medicine.
That you have to get into, right? Extra money you have to pay.
So so you get paid. So that's a job.
Oh, you get paid. Okay.
So you get paid. So you get paid as a resident. You get paid like almost minimum wage. So you get paid like 45 to 50K a year.
Wow, for 3 years, yeah.
Yeah. So that's like every year you get paid. So for 3 years, I think it goes up slightly. So it's, for example, it's like 49K 1 year, 50K second year, 51K.
Why is it so low? Like, there's just so much supply.
I think that's part of the problem in healthcare. Yeah.
No,
I think these guys are
really. I mean, so that many
overworked.
people who want to be doctors.
Yeah. So these are people who want to be doctors, but they're working almost close to minimum wage in so many hours, and they're doing so much good work in the hospital, but they're not being compensated for it.
I thought that there was like there weren't that many doctors that wanted to work as doctors. I mean, like I thought there weren't that many people wanting to be doctors.
No, there are a ton of people, because what's happening is you're having like an oversaturation of people going into the medical field, where now there are not even that many residency spots. The year that I was applying for residency, there are 11,000 medical school graduates who went without a residency spot. 11,000 people. Imagine graduating from med school, you don't even have a job after that.
Wow.
You put in 4 years, you have like almost close to $150,000 to $200,000 a debt.
I mean, that was at that school, or where was that?
Nationwide.
Nationwide,
11,000 people went without.
So what happens?
residency
Like
spot.
they go elsewhere? They go abroad, or?
So they wait. They take like a transition year where they're doing research, and then they come back again. They apply for residency. Or they do like an MPH.
I mean, so were they turned down based on their scores, or based on what?
I think scores. Scores is one thing, and research.
Scores and research.
Scores and research, and what med school you went to. It's kind of like a, what do you say? Based on the type of med school you go to, you have an easier chance of getting into residency.
Right, okay. All right.
So if you go into the top tier of med schools, it's easier to get like a top tier
so
residency.
you applied to the hospital, or you applied somewhere else?
To the hospital.
To the hospital. Okay.
So that's why
So
every
it's
hospital doesn't have a residency.
So it's
you
basically a job application.
It's a job application, exactly, and you go on an interview, and it's like a group interview. So if you go to so I applied to some hospitals in the Baltimore area. So I basically went over with these med school guys, and then all these guys were there. It was like a group interview. They were going around the room introducing ourselves, and they're talking about the different programs that they had, your normal day-to-day schedule, and you were basically there from morning until afternoon.
Wow,
and that was your interview.
That's crazy.
Yeah, that is crazy.
All right, so I think that was the time where me and you kind of began talking again.
Exactly.
Because I know when you went to medical school, you were pretty much buried in books.
Exactly.
And I didn't really hear.
I was basically MIA, right?
Yeah, you basically
For 4
MIA
years.
for like 4 years almost, right?
Yeah.
Then I think we ended up meeting how again? I think either I texted you or you'd called me or something like that, and kind of.
I think around that time I might have switched phones or something, so you didn't have my phone number, so you sent me a message on LinkedIn. You're like, hey, what's your new phone?
Yeah. All right. So then I know from there you wanted to make a career switch.
Exactly.
All right. So I mean, so let's say you had gone on to be a doctor. What was like the expected income you would have like per year?
I think for me, I wanted to go into internal medicine, so I think right off the bat I'd be making over 100K, maybe 150K.
Like that's it, really?
Yeah.
Just that?
Just that. So that's without specialization. If you specialize, they say, I don't know how much of it is factual, but they say 250 to 300K for like a specialist. So a specialist meaning like an oncologist, cardiologist.
I mean, so was your plan to specialize or not to specialize?
My plan was to specialize.
Okay.
Because I knew that I would just be making like 100, 150K max.
Right,
That's
right.
it. If I did no specialization, if I just did general internal medicine.
How do you specialize? Is that more
So that's
skill level?
fellowship. So that's another job that you do, fellowship.
How long is that?
So that depends. So if it's cardiology, it's 3 years. If it's oncology, it's 3
So
years.
it's just like 6 years after, yeah.
Yeah.
6 extra years. So.
So 5, 6 years after med school. Yeah.
Okay, interesting.
Yeah, but you're getting paid. But still, you're not getting paid like.
I mean, so basically,
position.
like an average doctor who's generalized makes like 150K or so.
Average.
Average. If you specialize, it's like you said 250, 300.
Yeah, 250 to 300. I think some cardiologists go up to 400K.
Okay, interesting.
Yeah, but not all.
Not all.
It all depends. There's a lot of factors that, for sure, the hospital you're working in, the amount of research you've already done, and so forth. That also plays.
I mean,
a
so
role
does the
in that.
hospital pay you? Because I know some people you mentioned get paid per surgery, for example. I think.
Exactly. So those are surgeons.
So
So I'm
surgeons.
talking solely about internal medicine, which is a non-surgical specialty. For surgery, it's a lot more years after med school, but it's a lot more pay. And then when you become like a surgeon, and you'll become specialized. Like I had a surgical oncologist who I worked alongside in med school. He's a surgeon at Howard University Hospital. This guy was coming in, doing like breast resections, taking out cancers, taking out tumors, and he was making $8,000 per procedure. One day, he had 6 procedures and made 48K, and he walked home happy.
I mean, so I find that to be kind of a bad model, though, right?
Mhm.
Because this is just my personal take. That's from my family. Like, doctors are almost incentivized to want to do more procedures.
Mhm.
'Cause I know my younger brother, we went to Johns Hopkins because he had some kind of hurt defect, or I don't know what it's called, like a murmur or whatever. I don't
Okay,
know.
I remember.
Right? And the doctors wanted to operate on him.
Mm.
My mom was like, hell no, hell no.
Without doing any diagnostics, doing any labs?
No, I mean, like there were like multiple trips they went there to Johns Hopkins, right? Because
Mhm.
we were back then we were in Columbia, Maryland, but
Okay.
they referred us to Johns Hopkins because this is like the best or whatever, right?
Sure.
And the doctors wanted to, they were like adamant about like doing surgery
Mm.
on my younger brother, and he was like I think like around 2 years old.
Wow, that's insane.
And they're like the side effects to this are like he'll be like I don't know like, I guess what was the term for it? He basically won't be normal anymore, right?
Side effects of the procedure?
Yeah,
Or side effects of the condition?
Yeah, so side effects after they do the procedure because they'll do some stuff I don't know. What.
Wow, so there's no guarantee that the procedure would even work.
Right.
Even
I mean,
solve the problem.
so basically he would be worse off, right? But
Wow.
apparently he would have a chance to live,
Mm.
right? So my mom was like, you know what? No, I'm not doing this. This doesn't mean right. What's the point of doing this if it's just gonna be like disabled for his whole life,
Mm.
right? So she said no, but then we had to do like annual visits every single year.
Mhm.
My mom's like, you know what, I'm just gonna do the whole, I guess the whole just not do anything, right? I don't trust you guys because it seems you guys are just doing this for the money, right? Fast forward like 10 years later, he's still perfectly fine, no issues, nothing.
Exactly, no
Doctor was
procedure
like-
necessary.
Doctor was like, you know what, I messed up.
Yeah, that's not
I'm like,
very
you know,
common.
like,
It's
you-
not uncommon.
You're playing with somebody's life here, right? And it felt like the doctor was just doing this because he was trying to get paid.
Yeah.
You know, because he was like, hey, maybe I have this debt I have with my family. Maybe I have to pay the student loans. Maybe I have to buy this new Lambo. I don't know, right? So let me just take these people through this conveyor belt and do as many operations as I can to get paid.
Yeah.
I mean, so how does that work in the medical field?
So exactly, and you did a perfect allusion to that. The fact that a lot of doctors are dealing with the stress of paying off their student loans, and also they just want the money too. Like if you have a doctor who's making $8,000 per procedure,
Yeah, per
of course
procedure.
the incentive is there to go for the surgery even before doing any other intervention.
Right. I mean, because that's basically kind of like I would expect that more in something like sales, right? Because me and you both work in sales, right?
Right, exactly.
Because we get paid on commission, right? Because sometimes you want to close a deal and have a customer buy something. It may not be the best product for them, but you're like, I have bills to pay, man. I have a family to feed.
So you're thinking right away, you're putting your interests above that
Right,
of the
right,
customer.
right.
The doctor's putting
But I
his
feel like-
interests above those of
But
the
I feel
patient.
like in sales or like software, it's kind of understandable. But when you're dealing with people's lives,
Yeah.
it's totally different. Yeah,
I know.
You can't really have a cutthroat sales, almost Wolf of Wall Street model
Mhm.
in something like healthcare.
Yeah,
right?
where life and death is paramount every day.
Right.
So yeah.